Hi, I'm Dr. Namrata Agarwal, a critical care specialist at Borivali Healthcare. So today's topic is very simple yet very complicated, and without which nobody in this world will survive. Even a small plant, even a small insect needs this, that is oxygen. So how is oxygen important for your body, and how do we take care of oxygenation inside an ICU? So oxygen is very vital for each and every cell of our body. Even a small delay in getting the oxygen or a small delay where the oxygen support is less can lead to a deadly complication and even death of somebody. So oxygen is very much important. So we give oxygen inside an ICU by various forms, like by nasal cannula for mild oxygen support. Then we give via oxygen face mask or non-rebreathing mask for higher oxygen support. Sometimes through HFNC, that is high flow nasal cannula for patients who require breathing support also, along with high flow of oxygen. BiPAP, CPAP, ventilator for full support of breathe plus oxygenation, and sometimes when lungs are not working properly, then through ECMO. So these are the various modalities through which we give oxygen. So I don't know how many of you know, but we breathe oxygen through air, and the percentage of oxygen that is present in the air is 21%. So whenever we are breathing air, we are inhaling 21% of oxygen, and the 16% of oxygen is breathed out with our breath. That is, with expiration, we breathe out 16% of oxygen. So this 16% sometimes is effective when we are giving CPR and giving mouth-to-mouth breathing to the patient. So at least some amount of oxygen, that is 16%, is going inside the body of the patient who has collapsed. Also, oxygen prevents cell death and prevents the risk of heart attack, brain death, stroke, lung diseases, kidney diseases, and many other things. So oxygen is very much important. Even a minute or two of low oxygen can prove detrimental. Now I will tell you how do we check oxygen levels inside an ICU. So we all know about SpO2 probe, pulse oximeter probe, that we keep it on our fingers, which we get readily in any medical shop, and most of you must have had it during the COVID times to check the oxygen level. So that is the most cheapest, readily available and easiest form of checking the oxygen levels. So our oxygen levels or the SpO2 readings, maximum is 100 and minimum that is required for normal life is 94%. The oxygen level is between 94 to 100%, then we are okay, and we should not be worried about it. Sometimes in patients who have COPD, asthma or interstitial lung disease, their oxygen levels can be as low as 85% or 88% also. So in some patients, they will tolerate a lower SpO2 level, lower oxygen levels, but our body, normal healthy individual's body, will not be able to tolerate oxygen below 94%. Other method that we use to check oxygen level is ABG, that is arterial blood gas. That is an invasive method. We need to take out blood from the artery of our body. An arterial sample is required, which is sent for testing, and the machine level shows us the accurate measurement of the SpO2. Sometimes in some cases there can be discrepancy between the SpO2 level reading and the ABG, arterial blood level reading of oxygen. So that helps us in determining some of the diseases which the patient might be suffering. Most common is the nail polish that a female may have on her finger, which will show a lower SpO2 reading, but the reading will be normal, or the levels will be normal in an ABG, that is arterial sample. Some cases of poisoning, like carbon monoxide poisoning, cyanide poisoning. These all poisonings we can differentiate by performing arterial blood gas sampling. Also, this is very important to know that balancing oxygen levels is very important. When too less or too much, both can be detrimental. So if we are giving too much of an oxygen, then there are the oxygen free radicals which are formed inside the body and which can damage your eyes, kidneys, heart, lungs and other vital organs. On the same spectrum, giving too little oxygen can also cause a cell death and damage all your vital organs. So balancing oxygen is very important. Your doctor will decide when to increase the oxygen or when to decrease the oxygen as per the patient's condition and disease. So we as ICU specialists or our staff in ICU will have the role of monitoring the patient inside the ICU, keeping the oxygen delivery devices in check, and deciding when to decrease the oxygen support and when to change the oxygen delivery devices. Like if the patient has become bad or has worsened, then the oxygen from the simple nasal prongs needs to be changed to maybe an HFNC or maybe to an NIV or sometimes on ventilator also. So this is what we as ICU people do, keep the check of oxygen and decide when to escalate or de-escalate the oxygen therapy. You as patient's family members needs to know that the patient is on oxygen, what type of delivery devices have been used. You will see patient being on face mask, patient will be on oxygen cannula, or patient being on ventilator, and you can check with your doctor about how much percentage of oxygen that the doctor is providing. We breathe at 21% and the maximum oxygen that is given is 100%. So patient will always be in between this percentage only. Your doctors will decide when to remove the oxygen therapy, when the patient is improving, and if at all need of change of oxygen therapy. So oxygen truly is a life's breath. Every day, multiple lives are saved by giving just simple oxygen. Oxygen is the best medicine, but too much can also be detrimental. Thank you.